Good morning. Thanks to Jay and Vicky for interpreting this morning. As always, I'm going to run through the numbers at the top here. Safe to say, we're making some progress in Hamilton County, but we are not out of the woods. So let's run through the numbers. Total positive cases of COVID-19 in Hamilton County sit at 72,486. The increase from last week is 1,241. Hospitalizations are at 2,534. The increase from last week is 25. And the death toll in Hamilton County is 944. The increase from last week is 31. Again, that death number is quite a bit higher than what we have seen, not so much last week, but in weeks prior. Some of that, we think, is us catching up from what happened at the state level with the undercount, and so we're still catching up. But we don't think it's all just catching up. What we know is that there are people dying in Hamilton County. It's a lagging indicator, and it's one indicator is how many people are on respirators in the hospitals. And so today there are 68. A week ago there were 90. So some of that is showing up in the deaths in Hamilton County. So we think it's a combination of these two things. So today Greg Kesterman is going to talk in further detail about the COVID trends and the numbers. Greg obviously is the Hamilton County Health Commissioner. And then Dr. Jennifer Forrester of UC Health is going to join us. Dr. Forrester is an infectious disease expert, and she's going to talk about the UK variant and just what it means to have a variant in your community and what our response should be. I do want to remind people, and we were saying this like a broken record early on, wash your hands, wear a mask, distance yourself from one another, and reduce your COVID footprint. These are still very effective strategies, whether we're talking about the variant or not. These strategies work. We know it. We've had some success because of the community responding to that, and we need to be vigilant. We need to keep doing that as people get vaccinated in our community. One thing before we go to Greg, I've been asked quite a bit about vaccine distribution in Hamilton County, and we have delineated where the vaccines are going in Hamilton County. They come into the state. The state has a formula by which they distribute the vaccine to every county in Ohio, so all 88 counties. Some of that is driven by population, and so we are getting more than many counties because our population is so high, and there are a couple other determining factors that the governor uses. So we get our doses, and the majority of those doses go to the healthcare systems, the hospitals, and we've talked about this many times, and they've got their systems for distributing that vaccine. Some of that vaccine is going to FQACs, some of it's going to pharmacies, and then some of it is going to public health, both at the county and at the city. That's the distribution, like kind of tree as you move down. And you can see that on the website as you go and try to sign up for the vaccine. You can see all those providers in the community. And so I've got a graph, it's already up, thank you, that talks about how we're doing with vaccine distribution. And so, as you all know, we are in a holding pattern for people that are 65 and over. We're in that holding pattern to try to catch up, to make sure that those folks that are likely to die from COVID, remember that percentage 65 and over is 87%. 87% of the deaths from COVID-19 are people 65 and over. The rationale then is that people 65 and over should be first in line to get the vaccine, behind folks in 1A, so the healthcare providers and first responders, and then behind the teachers. The teachers are kind of in the mix too. All right, so this is how we're doing though when it comes to the administration of the vaccine and these are Hamilton County numbers. So as you can see, of the population over 80, 60% of them have been vaccinated. 75 to 79, it's about just over 54% have been vaccinated. 70 to 74, it's around 46%, and then 65 to 69 is just over 30%. So you can see that the method to make sure that the oldest in our community get vaccinated first is playing out here in Hamilton County. The numbers for the folks that are younger are reflective of the teachers and the health professionals that have been getting the vaccine as well. So just wanted to bring everybody up to date on that. The other thing is the method by which we are distributing the vaccine. So as we have stated a number of times, there are some disparities playing out in Hamilton County. They're playing out countrywide, they're playing out statewide, they're also playing out countywide. And so we are trying to be intentional when it comes to making sure that people in this community have access to the vaccine. And so I'm going to give you the example of what public health, the county public health is getting this week. So we're getting 2,300 doses in Hamilton County public health this week. 20% of those are going intentionally into communities that are hard to reach. So that's about 460 vaccines. And so we're being very intentional, going to places that are trusted places in these communities to make sure that people are getting that vaccine and feel safe in going to get it. So that leaves about 1,800, just over 1,800, that are going to everybody else. So that's the vast majority of the vaccines. Most of them are going to the Board of Elections, where the county has set up a distribution site, easy access, middle of the county. I mean, that's also intentional. And then there's a randomized system where people sign up to get vaccinated that are eligible, and they are chosen randomly and then directed to the BOE. So the vast majority of the people being vaccinated in Hamilton County by public health are being vaccinated at the Board of Elections through a randomized draw. A little bit of that is also, again, targeted to some hard to reach communities or senior communities. And so, for example, as I said, the vast majority going to the Board of Elections. The Council on Aging is providing transportation for seniors to get to that location. I think that's really important because COA has always been such a great partner for us. The county is providing funding for that, by the way, but COA is providing the rides. We are going to a Miami Township Senior Center. We're going to other senior buildings throughout the county, going into some congregate settings, and we've got another site out in Anderson. We also have a site coming on in Forest Park. So as you can see, we are trying to move these sites around the county, but the vast majority are going through the BOA. Greg Kesterman tells me that everybody in the county is within at least 10 minutes of a vaccine site. So I think that's really important, again, when we talk about access. So I just wanted to clear that up because I think there's been a little bit of confusion about how the distribution is going. So with that, I am going to turn it over to Greg to run through the numbers and the trends.
Good morning, and thank you, Commissioner. As we meet this morning, I'm proud to report that it's been about a month that I've been standing here with positive metrics, so many things are heading in the right direction. We continue to see decreasing cases. Reproductive values seem to be heading in the right direction. Hospitalizations are decreasing, as well as intensive care unit admissions. Also, good news is this week we're continuing our vaccination efforts, and after looking at the weather, we don't have any snow this week, so that's very good news for my team as well. Before I dive into the numbers a little deeper, I like to always remind folks that there is a lot of opportunity for testing in Hamilton County. One of the main tools we've had throughout this pandemic in slowing the spread is getting yourself tested if you feel sick, and that way you can isolate yourself and quarantine those around you to help keep our community healthy. So please visit our website at hcph.org to find out any opportunity for testing. Once again, it's a critical tool and it's really important that we use it to slow the spread of COVID. Looking at our cases a little bit deeper, on December 10th, we still have had our highest peak with cases. We were at 716 cases per day. We are now down to 170 cases per day, so a significant decline. We are very proud of that trend and hope that it continues. At this point, we are free from any fallout that we might have had as a result of parties on Super Bowl Sunday. No holidays in sight, so hopefully we can continue to see this trend decline. St. Patrick's Day is coming up, and so just continue to remember that we each have a personal responsibility to lower our COVID footprint. Take and make choices that are going to help reduce the spread of COVID, continue to wear those masks, social distance, and keep sick at home. There remains still a lot of COVID in our community. So even though things are heading in the right direction, there still are about 5,000 cases of COVID with individuals that are sick right now in Hamilton County. So the opportunity does still exist. And so it's really important with all this good news to remember to calm down and realize that we've got to be careful. Looking at our reproductive number here in Hamilton County, today we are at 0.90. This number has now been below 1 for about a month. So that continues to show a decline in cases within our region and county. As far as our hospitalizations, our region's hospitals are seeing about 300 patients per day. This is down by 100 from where we were at just over the last couple weeks. You may recall the number of those being hospitalized throughout much of November and December was much closer to 800 patients in the hospitals over that period of time. Similarly, in our intensive care units, we are below 100 today. For a long time, we were at over 200 people within our ICUs, so significant declines. These are all very positive. I want to touch base very briefly on the variant that we discovered and did a press release on earlier in the week. We did discover the UK variant, also labeled as the B117 lineage, this week. Our team did contact trace with that individual, and they were appropriately isolated during their period of infection. At this point, they're actually out of their isolation period. Symptoms have resolved, and the patient has been released from isolation. The variant was detected using routine surveillance tests that the Ohio Department of Health submitted to the Centers for Disease Control. I think we'll get into this here in a few more moments when Dr. Forrester comes on, but it's worth pointing out that early scientific reports found no evidence to suggest that the variant has any impact on disease severity, and the vaccine is still has efficacy against it. In Ohio at this point, there are 11 positive cases that have confirmed variants in 6 counties. That includes Cuyahoga, Hamilton County, Lorain County, Median County, Portage County, and Ross County. Changing over to vaccine, there does continue to be a lot of excitement with vaccine here in Hamilton County. There are more than 50 providers providing vaccine to our community. This week, we are getting more than 14,000 doses coming to Hamilton County as a whole and going to those 50 providers. We have successfully vaccinated, at least with 1 dose of vaccine, 110,000 people here in Hamilton County. So we're making significant progress. As Commissioner Driehaus highlighted in her slide, for those that are over the age of 80, we've been successful at vaccinating 60% of those individuals. So we are clearly making an impact on those that are highest at risk, and we will continue to work with our partners to make sure that we have access to our seniors, as well as making sure we have equitable access within our community. Yesterday, our team operated out of Lincoln Heights Missionary Baptist Church, and tomorrow we will be out at the Word of Deliverance Church. We have successfully signed up over 450 people at these 2 clinics, and we're very grateful for the partnerships and helping us get into both Lincoln Heights and Forest Park community. We will continue to make sure that we're providing access to vaccine both within our hardest hit communities as well as all throughout Hamilton County. We have clinics that we hop around throughout Hamilton County to make sure that we're providing vaccine to all of our communities. There remains a lot of demand, and we know one of the biggest concerns that I hear on a routine basis is that I'm 65 or I'm 75 and I can't find a location to get vaccine. It's for this reason that the governor is holding steady at those 65 and older to make sure that we're providing enough opportunity to get everyone who wants it vaccinated. We know it's a big task, and the biggest factor that is slowing us down is the amount of vaccine, but we will continue to do this work to make sure that everyone who wants a shot can have a shot. As we continue on, I think the most important thing that I can say, you've heard me say before, is that the tools that we have for fighting COVID-19 are pretty basic, and they have worked. It includes wearing your mask, social distancing, washing your hands, and keeping sick at home. So as we move on beyond this week, please continue to do those things until we can get enough of our population vaccinated and we can make a difference here in Hamilton County. Thank you very much.
Thanks, Greg. And so now we are very grateful that Dr. Jennifer Forrester from UC Health has joined us to talk about the variant in general and then talk about, specifically the variant in Hamilton County. So Dr. Forrester, thank you so much for joining us. She's joining us virtually.
Hi, thanks, Commissioner, for welcoming me. I really appreciate the opportunity to get the word out and help protect our community. Thanks for all you're doing as well. So all the attention on these variants makes them seem completely alien, but really when viruses multiply or copy themselves, they make a lot of mistakes. Scientifically, these mistakes are called mutations, and this happens all the time. This is what all viruses do. Some virus mutations happen and then go away, and we don't really care about them because that mutation makes the virus less active or actually hurts the virus. But as a virus spreads and is allowed to copy more and more and therefore make more mistakes, statistically, eventually some of these virus mutations, like the ones we're concerned about, allow the virus to do its job better, to increase its survival. SARS-CoV-2, which is the virus that causes COVID-19, is a type of coronavirus, which is a group of viruses that look like they have a crown surrounding them. And that crown is made up of things called spike proteins, which is how the virus attaches to and infects human cells. The variants that you've been hearing about, the UK variant in particular, but also the South African variant, for example, have mistakes or mutations in that spike protein, as well as other mutations. And what we have seen is that these variants seem to be more infectious and potentially more dangerous just kind of by the numbers, right? The more people who are infected, the more chance that someone has an adverse outcome, has more severe disease, or actually dies. Though, as Commissioner Kesterman said, there is not clear evidence that it actually causes more, that these variants cause more severe disease in individuals. But regardless, this is why we're concerned about them and why we're looking for them in screening for them at times. The vaccines that we currently have help our bodies make antibodies or infection-fighting molecules that recognize and attack these spike proteins. So the logical question is, what do the variants that have changes in these spike proteins mean for the efficacy of our vaccines? Well, the good news is that it appears our current vaccines still protect us against the variants that we know about now, though some may be mildly less effective than they were against the original strains. But remember, this is what viruses do. There will be more mutations as COVID-19 spreads from person to person, and probably more variants. And this is why, until a large proportion of the public is immune and protected, it's still important to continue with those practices that we know work to stop the spread of the viruses. Obviously, you've heard these. Here's the broken record: masking, social distancing, hand washing, cleaning high-touch surfaces, and then staying away from people when you're sick, getting tested if you feel sick. If the virus can't find another person to infect, then those mutations and variants can't spread. So until vaccines are more widely available, we really cannot let our guard down just yet. Continuing with our vigilance not only protects ourselves and each other from potentially serious disease, but really actually stops variants in their tracks. So what we're doing now can work, has worked, and can continue to work.
Hey, thank you. Thank you so much. Really appreciate it. Bridget, I think we're ready for questions.
Sharber from WVXU has a question for Greg Kesterman.
All right. Good morning, Greg. Some good news coming from the FDA. It's looking like emergency use for the Johnson & Johnson vaccine will be approved by Friday. What's your reaction to this, and how will this impact vaccine distribution within the coming months?
You know, each new dose and each new type of vaccine just means greater opportunity to get vaccine into our community. So we welcome more doses coming to Hamilton County, and if there's a third provider or a fourth provider of vaccine, we're ready for it.
And of course, we are finally getting over all of the bad weather that's happened. But I know last night when I was listening to NPR, a story from Nashville came out that a lot of vaccine spoilage occurred during the period of bad weather. So how was vaccine spoilage in Hamilton County during the previous week?
You know, it's interesting. Once vaccine is taken out of the refrigerator, it has to be used fairly quickly. Most of the vaccine, both actually Pfizer and Moderna, have about 6 hours to get that vaccine used up once it's out of the refrigerator. But the truth is, we keep our vaccine either frozen until we're ready to use it or refrigerated when we're getting close to using it. And vaccine can stay refrigerated. The Pfizer vaccine can stay refrigerated for up to 5 days. So we had no negative impact from the weather with regards to spoilage.
And just one more question. With the new variant being here in Hamilton County, was that when you discovered that variant, was that the only case you guys have seen so far, or are there other cases that have popped up within Hamilton County?
Yes, from the knowledge that we have from the Ohio Department of Health, thus far, it's the only known case in Hamilton County. Our medical director, and I have shared this a few times on the show, has said many times that it's not a matter of if we're going to have variants here in Hamilton County, it's a matter of when. And so the probability that this is the only case of COVID-19 variant is fairly low. There's probably more. And that's why it's really important to keep doing those preventative measures and keeping sick at home.
Thank you very much.
Next up, we have Ann Saker with the Inquirer.
Good morning, Ann.
Good morning, everybody. Thank you so much. Good to talk with you all. Greg, my first question to you, just out of curiosity, can you let us in a little bit on what the contact tracing taught you about this particular, where the variant turned up in this particular person? Can you say if this was something that came into the home or whether this person got it at a store, or can you tell us anything about that?
I do not have all the specifics on the individual patient. We did find out, the variant was found out through the laboratory. They saw an irregularity, and that's when the sample was sent to the Ohio Department of Health. My team continues to contact trace on every single patient that has COVID-19, and so we treated this the same, and if there were other people that needed to be quarantined, those individuals were appropriately quarantined.
Okay, so you don't really know from the contact tracing where this person was and where this person got infected with this particular.
So I personally do not get involved in patient level data. I think it's wise for my epidemiologists and contact tracers to have that level of knowledge, but I personally do not.
Okay, I understand that this was a different instance. This wasn't just another case. This was something we've been watching for. So I just wondered about that. Also, I wonder, Greg, if you can, and now that we're getting some mileage of this decline in caseload and hospitalization and death count to some degree, what do you think and we've been seeing some stories in the last 24 hours that suggest that these vaccines actually are blocking the transmission of infection, not just preventing disease from progressing. Is that what is going on here?
I think there's a lot of hope that that's happening. And when you talk to folks that work within nursing homes and you see the drastic decline in COVID-19 cases in these environments that were first to be vaccinated, I think it's a very logical step to believe that the vaccine is working and slowing transmission. And as we get more of our population vaccinated, even just with one dose, we are making a difference in slowing the spread of COVID.
Dr. Forrester, would you like to make an observation or two on that subject, please?
Sure. Yeah. So certainly, many of the original studies did not. Some of the original studies didn't look at transmission, like you're suggesting. Though there are ongoing studies right now in, I believe, Pfizer and the AstraZeneca, which do show promise in that area that they seem to be reducing transmission.
And one other thing, Dr. Forrester, if I may, what if is 11 cases of this particular variant? What does that say to you? That maybe we got it in time, we got ahead of it, we blocked it, or these are just the first 11 we happen to see so far?
Well, I agree with Commissioner Kesselman a little here. Basically, that it's not surprising that we found one, that there are likely others. There may have been others before this, and there will probably be some after this as well, just by the nature of viruses. But it's all about stopping that spread. It's a little bit of a race between variants getting ahead of us and us vaccinating and protecting ourselves. So it's hard to tell exactly because it's not something that is a routine test. But I'm cautiously optimistic that we're doing all the right things, and continuing to do them will help us.
Right. And just one more question, Dr. Forrester. I wonder if you would kind of gaze into your crystal ball there and hazard a guess whether SARS-CoV-2 will end up being more like a flu, an influenza, or more like a common cold. Where we know yet where it will ultimately fall on the continuum of severity?
So my crystal ball is on back order. So I am
good. Okay.
about that one, but and it's hard to say that at this point. I think this is a virus. It's similar to other viruses. The family of coronaviruses, many of them are like the common cold. So can you relate them to that? But we've also seen this virus be very different than the common cold, right? Causing some real severe disease and death, which typically the common cold is not. To cause. So I think there's a lot of differences and some similarities, and it's really going to be hard. I can't hazard a guess on that, or I'm sure I'd be wrong at some point.
All right. Thank you very much.
Next up, we have Chris Wederick. He has questions for you, Dr. Forrester.
Good morning, Doctor. Just one question that we talking about the Do you think it's inevitable that we will see the South African variant, which kind of packed a bigger wallop in terms of the severity of it?
Again, unfortunately, I think that yes, I think we will likely see variants, whether it's a South African or whether it's even another one that may pack a bigger punch as well. It's a little bit of statistics in terms of mistakes, the mutations that the virus is permitted to make. But to make those mutations, it has to get from person to, for that to spread, it has to get to person. I certainly think that we are doing a good job as we're seeing that decline. And that's my optimism, is that by doing all those things, we're protecting us. But there is a chance that if it goes on, that we may see the South African variant or another variant with that may be dangerous as well.
One follow-up there. So would we get the South African variant because somebody had traveled here or connected with somebody who was there, or would we get it because it naturally occurs in the United States or Ohio, wherever it would end up being popping up?
I would say either of those are possible. So certainly, I do think travel where a variant is common and has been able to spread. Hence why it's in these certain areas is where we found them. But it's also been where the virus has propagated quite a bit. So certainly, travel is a risk factor for that in bringing it into the community. But statistically, also a virus can get those mutations, especially if they're not detrimental, but in fact help the virus do what its job is, which is, what it thinks it is, which is to infect others. Or find another host, I guess. So either of those are possible, but certainly trying to restrict travel is something that we've tried, that, the governor and others have tried to do as well, which I think is important.
Thank you very much.
And that seems to conclude our questions from reporters.
Okay. Thank you again, Dr. Forster, for answering the questions related to the variant. Thanks, as always, to Greg Kesterman, Commissioner of Health here for Hamilton County. We appreciate y'all joining, and we'll be back next week.